Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So in today's session, I'm going to discuss few important and repeated ICD-10-CM questions along with the scenario and explanation. So which will be very useful for your 2026 CPC exam. So that please do watch video till end, and if you find it informative and useful, please do subscribe to my YouTube channel and share with your other medical coding friends as well. So let's begin. So in current year, they have questioned about two hypertension instances. One is about resistant hypertension guideline and another one is hypertensive crisis coding guideline. Okay, so both of the guideline I have already explained in the earlier videos. Please do check it, and also you can take time and read the guideline. So it will be helpful even if you get this resistant hypertension question or hypertensive crisis guideline in your CPC exam. So next we will see the scenario based question. So the first question here, patient developed dyspnea and that is occurring episodically throughout the day and night. The physician suspect viral pneumonia and orders chest x-ray. Okay, so you should know the general ICD coding guideline. So whenever they mention suspect, okay, suspect, probable, and all these words where we cannot consider it as a definite, okay, so we will be not taking that final diagnosis. Okay, here as they mention, the physician suspect viral pneumonia, you cannot code your final diagnosis as viral pneumonia. Instead you can code the symptoms from the current medical record. So what is the symptom here? Patient is already developed dyspnea, so we will be coding for dyspnea alone. So the correct code would be R06.00. Dyspnea code you have to code. Okay, in options you can see viral pneumonia code. Please do not choose viral pneumonia code. Okay, so it is clearly mentioned, documented as suspects. Suspect medical conditions will not be taken as a confirmed diagnosis. Okay, so let's see the next question. So 50 plus year old with a type 1 diabetes mellitus comes in for a comprehensive high examination. She is diagnosed with a non-proliferative diabetic retinopathy with molecular edema. Okay, so this comes under category E10 and the patient is having type 1 diabetes and also retinopathy with molecular edema. So we have a combination code. So you have to select E10.3211, which clearly says type 1 diabetes mellitus with mild non-proliferative diabetic retinopathy with molecular edema, and the location is right eye. Okay, so this will be the correct answer for this question. So next, a patient is diagnosed with a benign hypertension and congestive heart failure. The provider indicates both conditions are unrelated to each other. According to ICD-10-CM guideline on hypertension, how should this encounter to be coded? Okay, so here the conditions are clearly unrelated and we have to code them separately. Okay, separately in the sense, when you are checking the congestive heart failure, here we will have the different types of heart failure like systolic heart failure or diastolic heart failure. Okay, if nothing is given, just congestive heart failure they have given, means you have to choose unspecified. Okay, so firstly you will code hypertension and additionally you will utilize heart failure unspecified. Okay, these two codes are correct for this current scenario. Okay, so next it will be which diagnosis codes are reported for the patient who has hypertension and acute renal failure. So here you should be very careful. Okay, if you don't have enough knowledge in the coding guideline, definitely you might go wrong here. So here they are talking about patient is having acute renal failure and not chronic renal failure. Okay, we don't have any combination code for acute renal failure. We do have combination code for chronic renal failure. Okay, so chronic kidney failure, whatever the conditions we have, we code first one combination code from I-12 series, and additionally we will utilize our stage of the kidney disease. Okay, that is for chronic condition. But here when you are dealing with hypertension and acute renal failure, you have to code them separately. Okay, so you can see option A here. They have given option A codes as these codes only applicable when you are dealing with a chronic kidney failure. Okay, since we have acute renal failure, the correct answer would be I-10 and N17.9. Okay, first we will code hypertension and additionally we will code acute kidney failure. Okay, so this is the correct answer for this particular question. So last question, we'll see one more question. So the last question is, patient present to an urgent care facility with multiple burns. Patient has a third degree burn to the left and right posterior thigh, that is for 10%, and also second degree burn on anterior portion, right side of that is again 18%, side of 18. No, some kind of blender here. It's okay. Just focus on the percentage. Chest wall is 8%, upper back 6%, total body surface area is 24% with a third degree burn, and totaling 10%. Third degree burn totaling 10%. So it's easy. First, which degree we will code? According to our ICD coding guideline, when we have a multiple burns, we have to sequence which is the most, like the highest degree we will sequence first. So accordingly third degree will be, we have to sequence first. So 311 and 312A is for right and left posterior thigh, which is third degree. And next this T21 series is for second degree of, this second degree of chest wall and upper back. Okay, and lastly this is for total 10% of third degree being burnt. So it will be going with the T31.21. Okay, question. A 43-year-old had a history of adenocarcinoma of the cervix on conization in March 2020, which has been followed with twice yearly endocervical curettage and pap smear that were all negative for 2 years. And as per the recommendation of gynecologist, her pap smear result from the last visit noted as atypical glandular cells. Atypical glandular cells means it's an abnormal cells. And she underwent a colonoscopy and biopsy of the normal appearing cervix. On colonoscopy was benign. The endocervical curettage was benign endocervical glands, and the endometrial sampling was benign endometrium. In the light of the fact that she had a previous atypical glandular cells that led to a diagnosis of adenocarcinoma. Okay, so now she has a history of adenocarcinoma. Before to that, she again, like same kind of atypical glandular cells were there, and then it led to adenocarcinoma. Okay, so now after 2 years she came back, like now the glandular cells are came back. So just she wanted to make sure that it should not turn to adenocarcinoma. Okay, so that is what concerning her, that this may have reoccurred, and she has been recommended for cone biopsy. So in this entire question, there is a note that she had a history of adenocarcinoma and current abnormalities are atypical glandular cells. Okay, so every AAPC questions, ICD questions, they will question based on ICD coding guidelines only. So here if you read this question, you should remind yourself there is a coding guideline from the chapter 2 neoplasm about the history of adenocarcinoma. Okay, when do you consider it as a history of adenocarcinoma is important. So here they said history of adenocarcinoma of cervix on conization in March. So assume it is some 2020 or any other year, and they have clearly mentioned who has been followed with the twice yearly endocervical curettage and pap smear that were all negative for 2 years. So from last 2 years she has no malignancy found. Okay, there were everything, the reports are negative for 2 years. Okay, then it means there is no malignancy present. It is like the guideline suggests what the guideline we have when a primary malignancy has been previously excised or eradicated from its site, and if there is no further treatment to that particular site and there is no evidence of an existing site like existing malignancy, then we have to code it as a history. Okay, so in this question also we can purely consider it as a history because last 2 years everything was negative, and now current year also she came for the abnormality of the result. Okay, so not like any treatment towards adenocarcinoma. Okay, so first thing we can code history here, and again if you finally check there is no a final diagnosis has been established, still it is in the process. So as of now they have found only atypical glandular cells, so we have to code atypical glandular cells also. So see the options, there are options with option A is, you can see C series, that is malignancy code, so you can directly eliminate this, and B also it's a malignancy code, you can eliminate this. And then option D, both are Z series code, that is one is history code and one is screening code, so you can delete this also. And option C is correct. Okay, option C is correct. I'll tell you why with the code description, so check for the answer. So here is the answer. As I added code description of the each code, you can check here. So R87.619, which says unspecified abnormal cytological findings from the cervix uteri. Okay, so there were atypical glandular cells found in our cervix pap smear, so that we have to code R87.619. And additionally, for the information purpose, we should utilize our history code, personal history of malignant neoplasm of cervix uteri. Okay, so she had a neoplasm, she has an adenocarcinoma of cervix 2 years back. Okay, and now there is no treatment towards the particular site. Okay, so that means adenocarcinoma has been completely eradicated. So this is the correct answer. So answer C, R87.619. Then we will code history code. So whenever we are coding, we need to follow the coding guideline. Okay, once you apply the coding guideline, then only you can able to choose the particular correct answer. If you don't know this particular coding guideline, what you will do, you will see the adenocarcinoma word, and you will choose the adenocarcinoma ICD code. Okay, that is not the thing. Here we have to apply the guideline and then we have to select the answer. So I hope it is clear. So next question. Patient comes to see her primary care physician for a productive cough and shortness of breath. The physician takes a chest X-ray which indicates the patient has double pneumonia. Select the ICD-10-CM code for this visit. So option A, you can see J18.9 and R05 and R06.2. So there are two symptoms are coded in option A. So when the final diagnosis is being established, so the final diagnosis is double pneumonia here. Okay, you should know the coding guideline that the integral symptoms and non-integral systems of the final diagnosis. Okay, so pneumonia is a final diagnosis, which is again a respiratory condition. With that respiratory condition, you should not supposed to use cough and shortness of breath as an additional codes. Okay, this will consider as an integral symptom of respiratory condition. If it is unrelated to pneumonia, you would have used it as an additional codes, but not here. Okay, so you should not code R05 or R06.2 with the double pneumonia. And then easily you can eliminate option A and option B, and you should have a confusion between option C and option D. Okay, J18.9 and J15.9. So J15.9 will be in bacterial pneumonia. So we don't have any specification regarding bacterial pneumonia. So you cannot code option D also. And then if you check here, they have specified double pneumonia, but you don't have any direct codes stating that double pneumonia. Okay, we will get pneumonia code under the parenthesis. we can able to see, or like the alternative word we say like this double, we will say like non-essential modifier. Okay, it will not change the code, instead it will be there in the parenthesis both in alphabetic index and tabular list. You can able to see with the pneumonia. Okay, so it's like, as I said, it's a non-essential modifier. It will be there in a parenthesis. Okay, it will just give you the same meaning. Okay, so for according to that coding guideline, we will select option C. So let's see option C code description. So J18.9, which says pneumonia, unspecified organism. Okay, so when you go and check the parenthesis of this particular code, both in alphabetic index and tabular list, in the parenthesis, you can see a non-essential modifier as double pneumonia, the word double. Okay, and also like what we say, it's like a supplementary word. Okay, supplementary word of pneumonia. So now unspecified organism we have chosen because in the documentation there were no organism being identified. So you have to go with J18.9. Okay, again I hope it is clear for everyone. So third question, what is the correct way to code patient is having bradycardia due to demerol that was correctly prescribed and properly administered? So here you should know the coding guideline for adverse effect of drug. Okay, and also here they have stated that they have correctly prescribed and properly administered. Okay, so now it is not like you cannot consider like demerol was not taken as an accidental or accidental overdose. Okay, also like it will not go to a cell farm, it's not a cell farm also. So we have a separate code for cell farm, right? It's not a cell farm. So what we have to do here, we should know the coding guideline, that what the coding guideline suggests us whenever we are coding for adverse effect scenarios. Code first, the first code primary PDX will be coded with the nature of adverse effect. Okay, what happened due to the adverse effect of drug. Okay, that nature will be coded first, then second we will code the adverse effect code. Okay, so that is how the sequence should be. So the first code here, if you see A and option A, B both started with T series, like they have initiated with the adverse effect code, so both are wrong answer, and we should check between C and D. Okay, here the bradycardia is coded first, so that is a proper sequence. But here we have a slight difference in T40 2x5a and T40 2x2a. So let's see what is the correct answer. So answer is C. You can see here R001 is a bradycardia. So bradycardia should be coded as primary diagnosis. Why? Because bradycardia developed is due to adverse effect of drug. Okay, so bradycardia will be considered as nature here. So then secondary code we are coding adverse effect of other opioids initial encounter. Okay, so T42X5A we need to code secondary. So this is the final answer. So let's see the next question. A 27-year-old was frying chicken when an explosion of oil had occurred and she sustained a second-degree burn on her face, which is for 5%, and third-degree burn on her both hands, that is also 5%. So total 10% of body surface being burnt. So what are the ICD codes needs to be selected. So this is the coding guideline we have for burn. Okay, so the first thing you should identify what kind of burn it is. Is it chemical burn or thermal burn? Okay, chemical burn means like contacting with any kind of chemicals then getting burnt. But here the patient has not contacted with any chemicals. Instead, he has contacted with the hot oil. Okay, so this will be coming under, it's a thermal burn. Okay, so we have to follow the thermal burn coding now. And you should also know one more coding guideline when we are talking about the degrees of burn or the total body surface area. So what the guideline suggests us to follow, we have to always go with when multiple burns are there, the sequencing guideline we have is we have to sequence the highest degree burn first, and the secondary code we need to go with the lowest degree burn. Okay, so totally we have all the guidelines here. Let's see the answer. So answer is C. So in the question you got a clear instruction that it was not a chemical burn. Okay, it was a thermal burn because it was an explosion. And then according to coding guideline, whenever we are sequencing the multiple burns, we have to sequence the highest degree as primary code. Okay, so on hand we had a third degree burn, and on face we had a second degree burn. So third degree will be the highest one, so we are sequencing hand first. Okay, so you can see T23301A is for third degree on right hand, and 302A is for third degree on left hand, and we don't have any bilateral code for this condition. Okay, if we would have had a bilateral code like burn of third degree of bilateral hands, then we would have chosen the single code, but we don't find any bilateral code for the particular condition, so we are coding them separately. And after that we have a face, that is for second degree, so we are coding burn of second degree of head, face and neck initial encounter. And after that we have to code total TBSA area. So in the overall scenario we are getting 10% of total body being burnt, so we have to select the range between 10 to 19% of body surface area. And then uh, we have to also code the external cause code. So here external cause code is contact with fats and cooking oils initial encounter. And lastly we can also code activity code since we know the activity. So patient was cooking, so we are adding Y93G3 code. Okay, so this much we have to code for a single condition. And again make sure you are going like everything. Once we start coding an initial stage of encounter, we should also give an external cause code with initial encounter. Okay, so this is important thing, and remember the coding guidelines whatever we discussed, that is important. Next, a patient that has a cirrhosis of the liver just had an endoscopy performed showing an hemorrhagic esophageal varices. So now in the options, if you see, all the options is having two codes. So now whenever we are coding for ICDs, we will be checking the instructional notes, like what is the exclude one note for the particular ICD code, what is an exclude two note, and also is there any use additional note or code first note. Okay, everything we need to check. And in this case also there is an ICD convention you should be knowing, that is code first. Okay, code first means whatever the underlying condition, whatever the etiology will be there, that will be coded first. Secondary we will be coding the manifestation code. Okay, so we'll see the answer. So answer is C. First we need to code K7460, and secondary we will be coding I8511. Unspecified cirrhosis of liver, primary diagnosis, and secondary we will be coding secondary esophageal varices with the bleeding. Okay, this is the final answer for the particular question. And whenever you are referring ICD conventions, please refer the usage of code first and also use additional notes. A 55-year-old patient had a fracture of his left kneecap 6 months ago. The fracture has healed, but he still has staggering gait in which he will be going to physical therapy. What ICD codes are reported? Okay, so as soon as you read the question, you should understand there was one condition was already healed, but now patient is having one more condition. Okay, that means the current condition might have originated because of the past condition. So here what guidelines will applicable? The Sequela code will be applicable. You should know how to code Sequela conditions. So you should also know that Sequela is a residual effect. It's a late effect. Okay, so following Sequela coding guideline, you can give the answer for this particular question. So we'll see the final answer. So in option you can see here, there were option A and option C started with the Sequela code. Okay, one is initial encounter, one is Sequela code. But here you cannot code this S series as an initial code. Okay, as a primary DX you cannot code this, because the Sequela guidelines suggest us whenever patient is returned for late effect, we should give the priority or the primary diagnosis, we should give it for the nature of the effect, not for the Sequela condition. Okay, so that means we have to code the staggering gait as a primary diagnosis, and then we have to code the whatever the sequela condition we will be having. So let's see the answer. So answer D, first we have to code R26.0, that is ataxic gait, and secondary code we will be utilizing unspecified fracture of left patella sequela condition. Okay, so S82002S. So again here also we are following the ICD coding guideline only. So whenever you are writing CPC exam, whatever the 5 marks direct ICD question you will be getting, in that cases definitely all questions will be based on ICD coding guideline only. You need to apply the coding guideline, then you can take the a correct answer. It's not purely depend on selecting the code by description. It not work like that. You need to know how to sequence for the particular condition or any kind of particular coding guidelines we have. Okay, so everything if you aware, then only you can choose the right answer. Okay, so next. So now let's see this 2025 CPC exam important ICD codes. So here I have only added important codes from diabetes. Okay, same way you need to check for circulatory system also, like hypertension with CKD, hypertension, heart disease or heart failure, how to sequence these particular conditions, like which category we need to code first, what are the additional code needs to be utilized, everything you need to check. More you need to focus on chronic conditions. Okay, and if you see here in the type 1 diabetes or type 2 diabetes, there are many specifications and there are many combination codes are exist. You need to check what kind of the abnormality, like retinopathy or neuropathy or nephropathy, and what is the type of diabetes, is it type 1 or type 2. Okay, everything you need to check and carefully you need to select the ICD codes. Okay, and you can also check here type 1 diabetes mellitus with unspecified diabetic neuropathy with macular edema. So this is with macular edema. Same way we will also have code for without macular edema. So you need to check the scenario specificity. Based on that you need to select the code. And lastly you can see type 2 diabetes mellitus with ketoacidosis without coma. So here also sometime what will happen, due to insulin pump failure, there will be like the complications will come. Okay, so whenever they are specifying that it is due to insulin pump failure, you need to code the mechanical complication first code. Secondary you need to code whether it is a overdose or underdose, and lastly you need to code the particular the diabetic condition. Okay, so all of these are important. As I said, please go to hypertension and also check COPD codes and sepsis, myocardial infarction with angina. Okay, all of these are very important. And yes, this is all about today's concept, and I hope I made a few guidelines clear. Okay, so if you have any doubts please comment and I can try to help you in the comment section. And